How to give glucose to a diabetic. Hypoglycemia, also known as low blood sugar, is a medical emergency. This condition can occur when someone gives themselves too much insulin, skipped meals, or exercised heavily. Knowing how to give glucose to a diabetic can save his or her life. Method 1. The conscious patient. 1. Give the patient 3 glucose tablets, if available. These tablets contain roughly 0.14 ounces, 4 grams, of glucose each. You can find them at most pharmacies without a prescription. If you do not have glucose tablets, you can give the patient 1 tablespoon, 15 milliliters, of sugar, honey, or sweetened jelly. Alternately, you could give the person 4 ounces, 118 milliliters, of fruit juice or non-diet soda. As a last resort, if you have nothing else on you, give the patient 5 or 6 pieces of hard candy. 2. Wait 15 minutes, then test the person's blood sugar. The meter should read above 70 milligrams, dl, for mmol. If the blood sugar level is still too low, repeat the treatment and test again. Method 2. The unconscious patient. 1. Check the expiration date on the emergency glucagon kit. If the kit is still usable, mix the glucagon powder and liquid as directed on the box. 2. Turn the person onto his or her left side. This will prevent choking if he or she vomits, which can occur after an injection of this medicine. 3. Tap the syringe gently with your finger to check for bubbles. If any appear, push the plunger slightly to force out the air. 4. Clean the injection site with an astringent. An easily accessible spot would be the upper arm. Let it dry for a few seconds. 5. Pinch a fold of skin in one hand. Hold the syringe close to the fold with your fingers off the plunger. Usually, the syringe is held at a 90-degree angle, however a 45-degree angle is often needed for small children and thin adults. This is to prevent the injection from going into the muscle. 6. Quickly push in the needle completely into the pinched area of skin. 7. Push the plunger in completely and give the amount stated on the kit's bottle. 8. Remove the syringe slowly. Be sure it is being removed at the same angle it was inserted. 9. Place the cover back over the used needle. Dispose of the used needle in a sharp disposal box as soon as possible. 10. Follow the procedure for a conscious patient when the person becomes alert. Emergency services should be called immediately if the patient does not come to within 15 minutes. Tips. Many diabetics wear a medical alert bracelet or necklace. Check for one when helping an unconscious person. Be aware that glucagon kits are by prescription only. An unconscious person may not have one. If there is no kit, call emergency services immediately. Sometimes a diabetic may be conscious, but too drowsy or confused to swallow something safely. Do not try to give food or drink. Instead, call for medical assistance. Warnings. Do not give an unconscious person anything by mouth. This may cause choking. When giving an injection of glucagon, do not insert the medicine directly into a vein. If you have not been taught how to give injections or do not have an emergency kit, call emergency services immediately for an unconscious diabetic. If a conscious patient does not respond by 2 treatments or loses consciousness, medical help should be obtained right away.